Aarthi, thank you so much for joining me on an N of one. I love having these conversations with people. I love population science. I love large data sets. I love all of the, the sort of things that come out when we look at what makes humans common. But all of us are special and unique, and you are super special and super unique. So I'm super excited to talk to you today. So thanks so much for coming on and talking with us.
Yeah, thanks for having me. I'm excited to chat.
So we always start by kind of taking you, I got to go way back. Like, tell me about young Aarthi. I'm talking like 8 years. If I got introduced to 8-year-old Aarthi today, what would be the overwhelming impression of 8-year-old Aarthi?
8-year-old Aarthi had two very big competing aspirations that took up most of my time. One was to be a wolf biologist and to try to live in a snowy cabin somewhere and study wolves. And the other was to be a novelist, which maybe has snowy cabin implications as well. But
also snowy cabin
so I was
stories about wolves. Wait a minute. Where did the wolves come from?
Yeah.
That's a very specific,
Lord knows, I have no idea. I think I've always been an animal lover and a dog lover, but the wolf passion was just somehow imprinted in my mind from a young age. So I was obsessed with the whole let's reintroduce wolves to Yellowstone. Let's try to get the wolf populations up. I avidly followed all of that at a young age and saved up my money to sponsor wolves. It was a whole thing.
Awesome. I went through a period where I was very interested in tigers in the same way. And the reproduction and saving of tigers. But to your point, if you asked me now why tigers, I have no idea why. I don't know what triggered that, but it was definitely tigers for a while. I love this. So you have not become a wolf biologist or a novelist yet, but the day is young. Who knows? Do you have a sense where the novelist part came from? Were you a creative writing kind of kid?
Yeah, I always used to write for fun. Ever since I learned to write, I was just always writing, inventing little stories on little slips of paper. And I didn't realize that was different or odd for a very long time. I just assumed everyone did the same thing. But yeah, I wrote all kinds of crazy stories, and I think it was just a fun way to escape into something different, think about something different. And I still write here and there, but I've developed enough self-awareness since I was a kid to realize I'm not quite the talented creative writer I thought that I was, but I still dabble for fun.
Is this the podcast where Aarthi comes out and is I am writing a book, Matt Waller? It's here it comes.
Maybe. Not quite yet, but maybe.
Not quite yet. I think you would write a fantastic behavioral science book. You've had such a wonderful, colorful career. So fast forward a little bit. Let's give us teenage Aarthi. Now she's 13, 14. Is it still wolves? Is it wolves this is a 10-year love affair?
Yeah, it was long. I'd suspect it was longer than your love of tigers. Honestly, what happened is the wolf population actually stabilized. They were no longer quite so endangered. And I had this moment of maybe I don't need to do this, or this isn't the thing I was supposed to do. And so that's when, although I probably would have done it had they still been.
Was there relief in that, or disappointment, or both? Were you I missed the window for wolf saving, shuck darn? Or was it oh, thank God the wolves, or a little bit of both?
I think a little bit of both, honestly. Very happy for the wolves, very bummed out that I wasn't gonna help save them, but generally pretty happy. But I think and probably started to have empathy for other things beyond wolves as well at some point. So broadened my horizons. But teenage Aarthi was starting to spend more time in India, just for family visits and family trips. And that's where I think my orientation around it just opened up my world, trying to really getting out of sort of my bubble of Pennsylvania and just sort of seeing like, oh, people randomly live in really challenging circumstances for no reason, like out of no fault of their own or no choice of their own. And just kind of like waking up and seeing that and experiencing it and not having anything to do about it, I think sort of started my journey into public health, even just like thinking about those as problems, thinking about those as things that could potentially be solved. And that, yeah, I think that's probably where I got this interest in health to begin with.
And is 13 to 14-year-old Aarthi thinking that might be a career, or that's just something that's starting to, like, if I had asked 14-year-old Aarthi, like, what are you going to be in the future? She no longer says wolf biologist, wolf novelist, wolf biologist novelist. Uh, does she say public health person?
Yeah, I didn't have the language or vocabulary for it, but I was like, oh, I want to do something, and I want to do something. I don't know how I would have described it then, like big, like systems level big. Like I don't want to be a doctor. I don't want to be sort of like an individual, like individually focused. I want to do something bigger and group focused.
Mm.
I had no idea what that meant. And I think that was the sort of exploration that started at that point, but got just really interested in like, are there ways to address these big problems? Like, are there tools? Yeah, and just kept learning from there.
That's interesting, right? Because that's an age at which a lot of people get hyper focused on the individual, right? I'm going to be a doctor or a clinician, or like there's a lot of like, teenage years tend to focus us on ourselves and others in very individualistic ways. So it's interesting that that sort of blossomed outward for you. Was that something you were like, did you take AP bio? Like, was it, was it starting to manifest as like, hey, in my studies, I'm going to start to take these things?
Um, I did all of the things. I was like very I don't know, like it was kind of just like in my family, it's like expected, like the academic performance is expected. So I definitely did like all the things that I could do. Um, but I guess actually at the same time that I was having these trips to India is also when I switched from a public school to a private school. And that also helped me see a really different world that I had not previously seen and seen like I saw people operating in different spaces that I didn't even know existed before. And so like that too kind of made me realize like, oh, there might be these other ways of being in the world that are not just these like three or four things that I might have thought about previously. But I had no idea what they were or like what it could actually mean in real life.
I love that. So there's this sort of broadening phase here for you, whether it's broadening perspective on the
Yeah.
world, it's broadening through school, right? It's recognizing there are careers beyond doctor, lawyer, whatever. Like there's this sort of broadening period that happens. When did you decide? Because you ended up at John Hopkins, right? And you were
Yeah.
your BA was public health. So like at some early point, you're like got on this train. Where did you start realizing John Hopkins, of course, is very medically focused? It's sort of in your realm, right? You were Pennsylvania, so it's not crazy. It's not like you moved to the West Coast to do this. When you started to apply for colleges, was this like I'm applying to schools for health? It's the Stanford, John Hopkins, like Cornell kind of version of the world, or were you all over the place? Like, was there an application to a wolf biology program?
I was all over the place. I think I was at a school where a lot of people were laser focused. They're like, I'm going to go to engineering school or I'm going to go to this program that tracks into this law school. And I just like, I was like, oh, like all of that sounds awful. But I didn't have a counter, like a counter
I don't know what I'm
proposal.
doing, but I know that's not it.
Exactly. That's actually probably been the vibe of my entire career for the most part, is just like seeing things I don't want to do and going in a different direction. But yeah, no, I explored a bunch of places. I think I went on a Hopkins tour and they mentioned public health as like a thing. And I was like, I don't know what that is. And so I, Googled it and I was like, oh, like this is a whole field that thinks about these things and like there's tools around it. And then I realized they have a whole school of public health there. And I couldn't, like, I started just clicking through and I was like, oh, like this is amazing. felt right. And that was actually pretty unique at the time. I don't think there were a ton of, and even today, a ton of colleges and universities that have undergrad public health programs. And so that is what drew me to apply to Hopkins, go to Hopkins. It's kind of what I did there. And it was cool. I loved it. Like that, talk about opening, like having courses and frameworks that really introduce that, having organizations, clubs, people that care about those things, was definitely like my introduction in how to think about systemic poverty, systemic health, all the things.
And there's such a lovely experience to what you just described in terms of finding out that something that you've been kind of independently noodling on is actually a thing, and that other people like do that thing, and there's a whole field around it. This happens all the time on open office hours with me, where people will, I'll just talk to people who are maybe a little bit lost about like, what do you talk to me about what's interesting to you, and then you can sort of say like, oh, that has a name,
Yeah.
right? It's a weird thing that got lost in the internet, because the internet sort of assumes that like everything everywhere all the time is accessible. And so if you have interests, everything everywhere all of the time will get accessed. But you still have to know the name of the thing, right? If you don't know it's called public health, it's hard to find
Totally.
material if you don't know the magic words that unlock the box that is the thing.
Totally.
That's really awesome. Fun side note, I almost went to Johns Hopkins for public health. We could have been classmates.
Oh, that would have been fun. Why didn't you go?
I got turned off. I was talking to an alum who was like, this is a very competitive place. He told me a story about people stealing books in the library so that other people couldn't have access to them. And I was like, I am just don't have a competitive bone in my body. It's really annoying. My partner is very competitive. So when we play board games, she's like really trying to win. And I'm like just having fun over here. And then if I win, it really makes her mad, because she's like, you're just over here having fun and you still won. So Johns Hopkins just sounded, the message I got from alumni was, this is going to be a place that might not be your personality. It's also quite big, right? And I'm from rural Oregon, right? Like I wasn't used to bigger places. So I went to Swarthmore, which is quite small, right? I think I was a little intimidated by the size, but the competitiveness was, did you find it very competitive? Was it like, it has a reputation. Was the reputation true?
No, it's not that competitive. I think, I mean, I guess like true anywhere you go, culture is a little bit what you make it, because you're actively contributing or detracting from the place. The only pockets of like true cutthroat competitiveness at Hopkins are among the pre-med students and among a slice of some of the engineering students, but broad public health folks, economics folks, like there's tons of good people, extremely like mission oriented, thoughtful folks.
That's awesome. And so was there any doubt once you kind of had a public health, economics, you had a mix of things so talk to me about coming into Hopkins. You think you're kind of going down this public health track, you found a little bit of love there. Then what happened?
I just kind of embraced it full force. I loved it. I joined this group called Association for India's Development, which is a cool organization that is sort of like a diaspora group that helps fund social justice projects, kind of grassroots, community-driven social justice projects in India. And that was amazing. So I was like, oh, I didn't realize you could fund things like that, like helping someone, a village that's decided they need a well, like, oh, like, look, here's a place to actually help make that happen. And it was really self-reinforcing, because I was in these classes and then I was in these sort of group meetings, and you started facing really real world decisions of like, we only have X dollars, which one of these should we fund? Or like, how might we increase how much money we have so we can fund more of these? Or, hey, should we ever check back in and like see what happened and see if the thing worked so that we can just choose better next time? And so like that became actually a really cool place, like low stakes, friendly place to apply some of the stuff I was thinking about in school. And it was just like a really nice, I think, mutually reinforcing experience. And it was great. And then I decided to go abroad one summer. I spent some time in Nepal working on like micro health insurance programs. And like, again, it was just another broadening. And then spent some time in India and study abroad, and spent some time in Jaipur and Rajasthan, which is in India, one of the places with pretty low like literacy rates, sort of all the things, GDP, et cetera. Yeah, and again, it was just like starting to realize the nuance of all these things and how big some of the solution spaces were, like starting to realize like, wow, there's a thing called the Global Fund that invests billions of dollars in this, or like the Gavi Lines, billions of dollars in vaccines. And again, just like a broadening and understanding of all the different ways you could come at these problems, from that $1 billion program to this community deciding they need $5,000 to build a well, and trying to navigate the complexity between that. That was kind of my college experience, just like trying to take it all in, learning, exploring.
Well, and there's some seeds of applied behavioral science in there, right? You talked about, you know, maybe we should check back in on this. Well, like, did it work? Like every intervention, you had this sort of, again, to your point, young, small, naive version, but still like, hey, like this, everything is an experiment. Every intervention is an experiment that might not work. So we could build this well, and it's not guaranteed to work. Like it has a probability of failure that can be quantified, that we can check on, that we can learn from, that we can use to change our investment strategy. So I heard that, I love that impact evaluation piece. And, then the limited resource piece. So much of academia imagines this bountiful world of just like everything all the time, follow my interests in whatever esoteric topic that I'm doing. And it is important to recognize like, no, there is limited time and limited resources. And one of the functions of science is helping us allocate those effectively, right? Like
Totally.
I was having a conversation with someone the other day. You don't need science. If you had infinite resources, you wouldn't need science, right? Because you could just literally fund every version of every experiment of every intervention. There would be no
Yeah.
selection, and so you don't need any evidence. You just like, I fund it all, right?
Yeah. Totally.
Science is only useful because it's like, well, that one has a higher probability ratio of working based on the evidence available to us, and so because we have limited resources, we're going to back this thing.
Totally. And you just realize, even like doing those small projects in college, you just realize the many different kind of like inputs and nuances to it, right? Like, oh, like this community might be more engaged and is like really taking care of this well. This one, not that committed. And you just like start to realize all the different gradations, and nothing is simple. But you got to like make the best decisions you can.
And so as you're coming out of like, you're having all of these emerging consciousness, what is going on from a professional perspective? Like you're going through college, you're doing this MPH, you go to Nepal, you have these experiences. Are you thinking, hey, I might be a grants officer, I might be sort of involved in international development? You talked a little bit about the World Bank and things. Like, is that the sort of emerging sort of feeling?
I have no idea. I legitimately had no idea what I wanted to do. It was causing everyone anxiety. I remember even my sister, who's not normally like interventionist, was like, maybe you should double major in economics just so you have this safety path. Extremely well intentioned. But yeah, no, I had no idea what I wanted to do. I had a lot of friends who were getting excited about consulting and doing case prep. I like went to one or two of those things, and I was like, this seems horrible.
The
For
no,
a
the
while, I
no
was like, maybe
vibes,
I'm
the
really
no vibe
interested in
strikes again. You're like, nope,
Nope.
nope.
I actually, because I didn't know what I was doing, I remember I went through some consulting interviews, and I got an offer from one firm, and I was more money than I'd ever seen in my life, which was not that much at the time. And I was like, wait, like, tell me a project you actually do. And they're like, oh, we're trying to increase the market share of like spinal surgeries for this hospital. And I was just like, no, very, very different than, very different from that public health vision. So what did I do? I was working internships with nonprofits at the time, was really having mixed feelings about, like, I loved the people, loved the projects, didn't feel scalable, definitely didn't feel like they were circling back and having strong, to your point, like understanding of the impact that they were driving. And so I didn't know. I applied to a bunch of jobs. I got some of them. I didn't like them. It was also the financial crisis, and it was kind of tail end of the financial crisis, and so everyone was just applying to everything. And then kind of by chance, I saw this role at the time, a startup group. It was a bunch of ex-World Bank folks kind of working on global health policy. It's gotten much bigger since then, but it was kind of interesting. They were talking about working with Gavi. They had some global fund projects, a bunch of Gates funding, and they were kind of working in a space that felt like the right level of impact, but like incredibly thoughtful people. And so I took on like a really junior generalist role there and just kind of went and learned, sort of did all the things, filed invoices, helped them with expense reports, planned people's travels, but then started to work on policy things and content over time.
And this is the R4D Institute. This is the sort of like
Yeah, results for
specifically
people.
impact oriented version of some of the stuff that you've been working on.
Yeah, and at the folks that founded R4D had heavy like health economics background, so they brought pretty strong impact focus. Again, at the time, I didn't really know what was what. I didn't even recognize that about that organization, but I'm sure that's come to shape how I think about a lot of things.
Yes, well, happy accidents, right? And you had been sort
Yeah.
of in the back of your mind thinking about this as you're building wells, right? And then you happen into an organization that sharpens that is very impact focused. And you were there for a while, almost 4 years, right?
Yeah, I was there for a long time. I had a great experience. I think when I joined, there were like 12 people. They were like rapidly growing, sort of winning a bunch of really interesting work. And so just had cool opportunities to grow with them. And just like access to spaces, again, that I didn't know existed or what they look like. I remember my first week, we went, there was like a UNHCR meeting, UNICEF meeting, I don't know, one of the UN organization meetings about responding to this like particular spike in HIV in a middle income country that was out of Gavi eligibility, out of global fund eligibility. It's like, what are we going to do? And it was just like all of these heads of these different organizations in a room. It's like, wow, like people like meet and talk about these things and like make decisions and do things. You can totally debate the impact and effectiveness of any of those decisions, but the fact that it was like happening was just such an interesting experience for me. And again, just opened up to like possibilities. So started working on a lot around kind of like vaccine access, a lot on HIV, started doing some work on how do you accelerate like biotech development for neglected diseases. Like how do you get a malaria vaccine faster? How do you get better pediatric AIDS formulations faster? Like what are the policy incentives you need to set? And so it was cool. I just got like a really, really wide understanding of different problem spaces, but also the different solution spaces people are working on within them. Um, but at some point, I still felt so far away from the problem. Like it was a lot of time in DC bouncing around between these really big global fancy offices and headquarters. And it was like, I always imagined myself being like closer to the problem or like closer to the actual places we were helping. And I definitely was doing high trip volume, but that's, like a in and out trip to a place where you're
It's
working
not
on a major
embedded.
policy.
So
It's
there's some
not a,
part of you that's still in a snowy cabin playing with wolves here. Like you want to be there close to the work, embedded in living. It is hard to go in somewhere for 2 weeks. You don't, as much as that just rapid learning curve happens in 2 weeks, and you do learn a lot from being on the ground. It's not the same as being embedded in a place for a long period of time and really getting to see the results of your work and work through all the daily problems that go through it.
and there's like an arrogance in it, right? Of like coming into a place where others are. And I feel like global health has gone and public health have gone through a whole renaissance of thinking about some of those implications in the last 10, 15 years. But at the time, it's still a huge culture of like external voices sort of determining how something might happen elsewhere. But yeah, I was really interested in going abroad. So I started looking at things like the Clinton Health Access Initiative and other organizations that were much more embedded, like in ministries of health that were in country. Um, but I had a like really amazing set of leaders and mentors at R4D. And one of the things that they helped me do was get that experience through them, where R4D was starting to have a ton of projects in India. We had partners there, but no people. And they kind of just like let me be their person. They're like, go to New Delhi, work on these projects, like strengthen all these partnerships. You can be like eyes and ears for a bunch of projects that we have there going there. And that was really amazing. And I think was a testament to you got to like work for people that are invested in you and care about you. And then things happen that might not be linear, seem feasible on paper. And so that was awesome. I just moved to India after a couple of years with them and started kind of representing some of their projects there, working there. It's in my early 20s in India, just like doing things I had no business doing, like walking into government offices and stuff, representing this org. But again, it was so much fun. And I got to see so many things, learn so many things, got to work on so many projects I wouldn't have otherwise had access to. But that's actually to your previous point about you like discover something and then find the field or the language for it later. That was 100% what was happening when I was in India, because I was starting to spend time with these low cost private school chains that we were funding, visiting some of these like vaccination sites that Gabby might be supporting, and starting to see like all of the little micro barriers that get in the way of like, oh, look, we've invested in this amazing cold chain, gotten this vaccine out to a place. You open that vaccine clinic at the wrong time of day, no one in rural India can come or bring their kids because they're like out working in the fields. Or I remember the hot topic at the time was TB diagnostics, where the government had made like sputum spear microscopies, was like kind of the best way to see if you have TB, freely available at all public health clinics. It feels like a low tech gross test to most people because you're like coughing up sputum essentially. And people in India didn't want to do it because they're like, there's no way that's accurate.
Right.
And all of these private companies were offering blood tests for TB that were totally inaccurate, but they were in a clinic.
But they have face validity, right? Like you're taking my blood and analyzing it, and it feels very sciencey.
Totally. And all of these really low income people were spending their hard earned money on these like really crappy tests and then getting TB, spreading TB. And yeah, I realized like, oh, there's like, what is going on? None of this makes sense. How do you make this system rational? And I was like, maybe the private sector knows how to solve these problems. It was like, Coke is out here in rural India and they've figured out how to take their global marketing strategy, make it super relevant in this far off place. And poor people are buying Coke wherever you go. And it's like, maybe they figured something out and we could bring that to public health. And so after a little bit of time in India, that's when I started thinking about going to business school because it.
And did you have the language of behavioral change, behavioral science, applied behavioral science sort of at that point, or it's just the sort of unnamed, hey, behavior is a problem and some people seem to have figured this out?
Totally unnamed. And to me, it just felt like logic. I was like, why wouldn't you open? Like, why wouldn't you find out when people are free and open the vaccine clinic at the right time? Like, why wouldn't you describe the test in a way that makes it more appealing to take? Like, it just felt, at the time, I just thought it was like basic logic. And somehow we in public health were missing it and doing things in an illogical way. And it's super naive. And I was like, surely the private sector's figured it out. Like they have all the money and the smart people. And again, like the Coke example, they're doing all the things, so they must know. And so I basically thought I should go to business school, like on that hypothesis of I will go there and I will find out all the things.
I will steal all the things from those Coke people that know. Little do you find out, really just Coke just spends a gajillion dollars, right? They're not good. They're not targeted. They don't know shit. They just have ungodly amounts of money. And that, they could just brute force their way into spending the thing. So
Totally.
you
Hired
go
all
off
the consultants.
you go off to business school, like thinking you're going to steal the gold from the wizard. Like,
Yeah.
did it, did you get there and it felt like you were stealing the gold from the wizard? Or are you like, oh shit, the gold is actually just painted rocks and the wizard is an idiot?
Going to business school is crazy. It was like the best thing I ever did and the hardest thing I ever did because I showed up there. I applied from India, so I like didn't visit any of these schools. I just kind of showed up in California.
You went to Haas at Berkeley, right?
Yeah, was fully expecting it to be like 90 degrees. Did not know anything about California microclimates. Um, and again, opened my eyes. I was like, who are these people? Like investment bankers, CPG marketers, product marketers, just like all of these people with all of these highly specific skills and functions. And it's kind of interesting to me because in the public health space, definitely if you're living abroad, like everyone does everything. There aren't these like fine distinctions of who's doing what because you're resource constrained. And so yeah, it was just like interesting. It's super hard. I'm a very introverted person and like I literally get tired in large group settings. And I was like, oh, business school is all team-based work and these kind of like confrontational case-based classes. Again, I just like knew nothing. I knew nothing about business school before I decided to go. I just followed my gut. But so it took a while to adapt to all that. I loved like I know most people don't go to business school for the coursework, but for me it was actually legitimately useful. I was like, oh, this is what marketing is, and here's how you do market research. Here's how we could have done market research prior to that immunization camp, right? Just like basic building block things. So learned a lot, got exposed, it was Berkeley at that time, like everyone's obsessed with A/B testing on like Airbnb was getting big, Uber was getting big, all these things. And so just like learning about how to think about some of the simpler experimentation frameworks is really fun. But I'd say, ironically, my biggest turning point in really understanding behavioral science and experiments and how they might apply in the context of health outcomes was again intersecting with the School of Public Health at Berkeley and meeting a really fantastic researcher there, Sandy McCoy, who is running a lot of HIV treatment adherence and prevention sort of experiments in Tanzania. And I actually don't remember how we connected. We just like organically connected. She was amazing. And I was like, wouldn't it be cool if we could try some of these business approaches like design thinking, like market research to these bigger public health challenges? And she was like, let's try to do it in Tanzania where I have all this research infrastructure. And so we just started collaborating and like ran some really cool experiments together in Tanzania about understanding sort of people's treatment experiences on antiretrovirals, thinking about like how do you provide positive reinforcement for attending visits in a place where attending a visit has a lot of stigma and a lot of cost associated to it for folks. I spent some time at a lot of her field sites, and that was when I could really see the dots starting to connect. I'd say that's the first time I had any language and like formal understanding of behavioral science. I was just pulling on some of the design thinking skills from business school into that. And throughout my career since then, I've increasingly had this idea of like this interdisciplinary way of how do you understand a problem, run some low fidelity tests against that to like crispen your understanding of it, and then run higher fidelity tests with much stronger quantitative signals to really see if it worked. And that really came together for me. I'd say like working with her and just like the mind meld that was happening.
Yeah, I think your point about business school is super well made in terms of there's a whole population of business school that's like, I can't get any farther without an MBA, right? Like I'm an AVP at Amex, and in order to become the next level of thing, I have to get an MBA, right? It's like a checkbox, networking, whatever kind of thing. And then there is, I genuinely never had a business education.
Yeah.
Maybe I didn't come from a household where that was some people get that passive, if their parents, if their mom's a CEO and they sort of passively get from mom what these things are. I vividly remember the first time I worked for a startup, uh, I was so fucking happy because they were offering me $60,000 a year. Nobody in my family had ever made $60,000 a year. I was like, holy shit, there's a ton of money. And about a week in, I was going for a drink with the founder and we were walking. I vividly remember where we were, like the West Village of New York, walking to this bar. And I was like, what's this equity stuff? And he's like, sorry, you accepted your offer without knowing what equity was? I was like, it's $60,000, man. It's more than anybody in my family's ever made. Right. But it's like,
Yeah,
if you grew up in the Bay Area or you're part of this thing, you just know what equity is, right? And it's in the water and it's just assumed. But, if you didn't and you grew up like doing public health work, no one has ever explained how, equity and shares in a company work. And so there is that whole, I wish there was a cheaper way to get it than business school and a faster way to get it than business school. But there needs to be like a crash course in like business models for people who have not been exposed. I tell young behavioral scientists all the time, I'm like, just take a microeconomics course. Just like understand how a company works. Just sit down and have somebody explain EBITDA to you, because you're going to need to know what EBITDA is at some point in your career as you get more senior. And nobody is teaching you, like nowhere along the line will anybody teach you what EBITDA is unless you go seek it out.
it's true. It's true.
So you come out so you learn these things. You're like, had this interesting experience in Tanzania. You're starting to get the language of behavioral science. You're starting to get this thing, and you end up at CVS. How did that connection, as you came out of sort of business school into, and you had been doing CVS work even prior, like starting pretty early in your MBA career, though. It wasn't like you graduated and went to CVS. You started before you graduated, right?
No, I didn't. So I went to CBS post-graduation, but
Post-graduation. Okay. So you graduate and then you go to CVS.
yeah, I mean, it was a similar story. Like, I had no idea what I wanted to do. I just knew, like, oh, I love this work that I'm doing with Sandy. How can I get paid to do this? Was my primary question. And, like business school, everyone is obsessed with like, what is their next role? There's all schools are trying to keep their stats up about all the things, right? How many like offers people are getting, all that stuff. So I went to all these recruiting events. Again, I just like it was the no game all over. I was like, oh, I definitely don't want to do this, don't want to do this.
BCG wasn't
Sounds,
calling to you.
sounds awful. Yeah. And it was a weird experience because so many of my classmates were so motivated to do those things and so interested in those things. And I was like, oh, am I missing something? But I think it wasn't the right thing for me. So Interform, I literally had no idea, was kind of applying here and there, having some interesting conversations. Someone who was working at CVS actually reached out to me because they were interested in potentially going to Haas and wanted to learn and wanted to transition to global health work. And so wanted to like know more about the program. And I chatted with her and she started talking about the role she currently had and how they were running experiments on medication adherence and like manually setting up pilots in stores to figure out how to drive these health outcomes. And I was like, oh, that sounds like what I want to do.
It sounds like Tanzania, but in the US. Like, aha, like I have found the thing.
Yeah. And then I was like, maybe CVS has figured it out. I was like, okay, Coke hasn't figured it out, but maybe CVS hasn't figured it out. I should go there and I should figure out what they're doing and like learn. And then I had a huge mental conflict. I was like, oh, is working for CVS mean like working for the man? And like, what is all this? But so she connected me to some folks there and had a few really good conversations.
How did you
And although
process?
they wouldn't,
How did you process through? I wanted to, before you move on the story, I want to double click on something because you said something really important there. How did you process through that conflict? Because I think that's a conflict that happens a lot for behavioral scientists. I was just giving a lecture at Columbia yesterday, and one of the students was like, how do you know what projects to take on? And I was talking about sort of like the ethical frameworks that we use. How did you grapple with that? And was it through further conversation with CVS about what they were doing? Was it just navel gazing until you sort of got yourself there? Was it conversation? Like what sort of got you there?
a little bit of both. So I've always had a really clear North Star that basically I wanted my career to improve the lives of the poor. Like I want to be able to look back over the arc of my career and be able to say, like, that's what I did. That's where I spent my time. That's where my energy went to. And I definitely had done it up until that point. And so for me, the question was like, is this a way to do that or not to do that? And so I had a couple of sort of different things running through my mind. One was similar to business school. I was like, I can go and learn and like take what I learned and apply that back elsewhere. Two, I was like, oh, I still have these projects in Tanzania going. CVS is going to let me continue to work on them. And those are unpaid things. Those are just like places I was spending time. Like this is a way to make that happen and let me continue to invest there.
So I'm going to steal
But then
knowledge from the man. I'm going to steal money from the man to support my Tanzanian habit. I love this. This is a great plan.
yeah, but no, then I also started talking to people and I realized CVS has something that I haven't had access to before. They have 10,000 pharmacies and there are CVS's in pretty much every place. Like they have a stat they're very proud of. It's like everyone lives in the country lives within like a 3-mile radius of a pharmacy, basically. Mm-hmm. And so I was like, oh, they are actually in the places that I'm trying to serve. Maybe there's a there. I wasn't sure. And so it felt like another hypothesis to go in and see. And when I got there, another lesson learned. I had no idea what role I had stepped into, but I just accepted it. It was a product role. Did not know what product meant or like what that actually was. But I was in charge of a product at CVS. And it was really cool though, because you could run really big experiments and they had this culture, they called it mini testing. Everyone at CVS ran these, what they called mini tests. And it was really cool to be in a place where like everyone was basically using an empirical approach to figure out what works to drive the thing that they were trying to do. And it was really cool to also be able to see the impact at scale. I was working on a product that was driving pretty big medication adherence impacts. And when you look at it, it was definitely driving it for the wealthy, commercially insured population, but it was also driving it for the Medicaid population, the duals population, people on like asthma medications. And so it was just like a different way of getting at the problem.
Well, and appeals to something you brought up earlier of the like, this is just logic, right? I know you worked on moving from 30 to 90-day scripts, and you're like, well, yeah, if you reduce the number of potential breakage points by a factor of 3, probably adherence will go. Like, in retrospect, this is like, you're like, why didn't we do this all along? So working on that, I mean, you could see the echoes through your career of this, like, oh, maybe there's just some like self-evident things that we could do. Now, getting them done, to your point, there's a massive amount of complexity that both you and I have worked on this problem that goes into getting from 30 to, you have to get the doctor to write the 90-day script. You get people to pay for the 90-day script. You get people to pick up it's not easy, but if you do it, 1/3 the breakage points just does cool things.
Yeah. And it's cheaper for people. So like, it's kind of a win-win. I think, yeah, it was great. I learned so much there. And what was nice is I was still doing this stuff in Tanzania and still, I just feel like I had a great flywheel mentally with Sandy where her way of thinking about problems, her way of approaching the work was so different than mine. And I could then like take what I was learning there and bring it to what I was doing at CVS. And it was interesting because although people are running experiments, I would say it was a spaghetti at the wall approach. People were trying to do what they could do. And at some point I had this realization, I was like, oh, like in Tanzania, because we're resource constrained, we do spend a lot of time understanding the problem space, de-risking an experiment before we invest in the 1 or 2 things we might actually experiment on. And I was like, why don't I do that here? And so then I literally just started calling patients, like CVS patients, and asking them, why haven't you converted to 90-day supplies? Here, 3 or 4 times we offered it in different places. Like, why didn't you? They had really useful, predictable answers. Like one of them was like, oh, I'm worried if I have that much medication, it's going to expire. It like won't stay good. That's like a mental models thing, right? Another one was like, oh, I saw that text message, but I only look at the preview that comes on the front of my screen. And so I didn't know what it was about. So I didn't click in. And so then I just started running all these tests directly rooted in what people had said, like sending messages that confirmed like this medication doesn't expire for 1 year, 2 years, or let's try to move the call to action of this text message into the first 3 words so people see it on their phone screen. And just saw like massive increases in uptake. And then like all the dots started connecting. I was like, oh, like this is again like logic. This is how we should solve problems. This is how we should run tests. And then just got really nice opportunities to continue doing that at CVS in different ways. So I started working on like flu vaccine uptake, started incubating a social determinants of health strategy, and how do we, our Medicaid adherence was good, but not on par with our commercial. So like, what can we do in certain communities to bring that rate up? And then it was like really that intersection of like, okay, here are the public health outcomes, here are the scale channels, and a place with the resources to do it. And kind of like perfect test bed for sharpening that kind of interdisciplinary way of testing and learning and figuring out the right way into something.
I love that there are echoes of the previous, like, because they have infinite resources, they're just, there's no point in sharpening. There is that mentality, you have to want to narrow down a little bit. You have to want to have some evidence in order for this to sort of take off. I love that you're starting to bring in some insight work. Are you starting to think of yourself as a behavioral scientist or use those words? Like, where is behavioral science like coming into the vernacular here? Because I know, if you look at how you self-present as a person, I'm always interested in when people start to use the word behavioral science for the first time, right? And so, you're sort of had been kind of 2.5 years into CVS, and then that's the first time, at least publicly, you start to say sort of, hey, I'm interested in combining behavioral science and design thinking. Where did
Yeah.
that come from? Like, where did you get that vernacular from? Where was that coming into your consciousness?
That was coming from all the Tanzania work. I'd say like Sandy was my first exposure to the formal world of behavioral science. And so we were doing it there. And at some point, I don't actually know what the transition point was. I think for a long time when I started at CVS, I thought that I needed permission to do things like, oh, like CVS needs a behavioral science strategy, or like they need to like sanction this. And then I realized I could just directly apply this to my own work in the span of the things that I control. And it can have a very massive impact. And it doesn't matter how I label it or how others label it or don't label it. And so that was actually the transition of like, it worked really well in that 90-day space. Now let's just try to apply it to more things. And then it started coming, I'd say, like more into the vocabulary and something that I was more specifically like advocating for and bringing into the mix, just seeing the results it was driving on some of these smaller initiatives.
Yeah, it is interesting how often there's like the inductive and deductive versions of behavioral science. Sometimes these days, right, at bside.io, we are exclusively in the space of people know they want it. They come to us, we help them get it, right? We help them set up their teams, et cetera, because it's at least permeated enough companies, right, that they know the thing they want. But there's a totally valid version of this, which I think particularly maybe 5 to 10 years ago was the most prevalent version, which is I'm just going to do behavioral science. And then when someone says, hey, why has this been so successful? You're like, let me tell you about this thing called behavioral. Surprise, it's been behavioral science the whole time. So it wasn't so much that CVS came to you and was like, I want to buy behavioral science from Aarthi, the behavioral scientist. It was Aarthi's doing, I want Aarthi to drive these outcomes. She's driving these outcomes, and people are going, Aarthi, you seem to have a special sauce. Like, tell us about your special sauce.
Yeah. I mean, I think that's the TLDR of any job, right? If you can drive value, that's the actual thing that people care about. And once they see that you're doing that, they start to care about how you're doing it.
Mm-hmm.
But like, you don't sell the tool, you sell what you get out of it.
Right. But then there's an opportunity to explain the tool, and maybe we should buy some more of those tools.
Yeah.
Maybe we should build a tool shed is a reasonable right? Like,
Yeah.
there does have to be some conversion point where you do need a behavioral science strategy and a team and the people and the things in order to be able to support doing the work. But it doesn't have to, like, you have to start there. It's not like you have to go buy a giant tool shed full of tools and then do carpentry. You can start with carpentry with the tools that you have, and then eventually get more expensive tools in a workshop as it becomes successful, as you demonstrate value. And so you have kind of pivoted here, right? Because you're sort of in the clinical services product development, and then towards the end of your career, but with the last 2.5 years of your career in CVS, you sort of go over into this more formally innovation sort of space. Like, what was that transition like? How did you sort of get there?
Yeah, I mean, that is the pitching that you were talking about. At some point, I just realized like this toolkit's really effective. I could just own a discrete set of products and bring it to those products, or I could make the tool set broadly available and try to apply that to any product that needs a boost, to any strategy that needs a boost. And so I just like pitched that as something we could do at CVS. And so we did the first proof of concept of that. I borrowed people, I didn't hire people, kind of like train them in some of the basics. And we did a few kind of like design thinking, behavioral design projects that resonated. And then over the course of the time, built that into the design and innovation lab, which was incredible because then we could work across the problem space. We got to incubate a lot of new things like video messaging, and the social determinants of health work started in the lab, kind of spun out, became its own thing. It's its own team now. And then COVID happened and CVS had to roll out the COVID vaccine. And it was really convenient that we had a team that could think about social determinants of health and vaccine messaging and all the things at that time. And so we just got to work on like a ton of really cool projects and to do it alongside with a lot of really strong product and operational leaders. So that was a ton of fun. And at some point, the lab, the people that helped me build it up were incredible. And I was like, they can run this thing. Like they don't actually need me anymore. Like they've given it all the value that I could. And at places as big at CVS, like if you want to progress, you have to just like manage more things. And I had many opportunities to do that I said no to because again, it just like wasn't. I didn't want to manage like a random set of products. And so for me, the question became, if I want to level up, like how do I do this with more difficult content and a more difficult problem space? And that's eventually what led me to Cityblock post CBS.
Before we go to Cityblock, I think there's something lovely you said there, which is really the pinnacle of any behavioral science career is the ability to step back and have it operate without you, right? That is a defining moment in a lot of leadership careers is like the moment where you're sort of like, wow, it doesn't need me. Because at the beginning, it absolutely needs you, right? Like you are there turning the crank every single day. And you are acutely conscious that if you even stop turning that crank for a second, the whole thing will lose momentum.
Totally.
Sort of, it's kind of like old hand crank cars. At some point, the engine gets going and you're like, cool. I don't have to turn this crank anymore. Maybe like I was talking to somebody the other day who like took vacation for the first time in several years and was like, and it didn't fall apart while I was gone. And that's when I realized I could leave this company was because I left for a brief time and it didn't just completely blow up.
Yeah.
And so talk to me a little bit before we go to Cityblock. You talked about having really fantastic people. How did you've been a great talent magnet, right? You surround yourself with really wonderful people and people want to work with you. I mean, I think you're somebody that people aspire to work with. Talk to me about building that brand, building that capability, building that sort of like, how do you sort of become the kind of person that people want to work for and with?
Um, that's a great question. I don't know if it's been intentional.
I know
I've
you're just
always had,
unintentionally awesome, Aarthi. I recognize this.
know what I'm trying to say. I think like my CVS experience, like I was doing something a little bit crazy. And so I had this like very steady, predictable product job that had a very clear career ladder that would be pretty easy to advance through. And I was like, no, I don't want to do that. I want to like set up this innovation lab thing where somehow I have to hit this like crazy margin target, although will no longer own anything, right? When you're own stuff, it's actually easier to pull levers. And so it was kind of a self-selection bias, like who wants to join me on this journey? A lot of people would not want to do that, right? But for the folks that did, for me, it felt like an obligation of like, I have to make this work for them. I have to make this meaningful for them. And also it has to be it can't be where they go for their career to die. It has to be like a path where they can do better and more impactful things than they could have done otherwise. And so part of it is just like finding like who are the folks that want that adventure, who are the folks that are comfortable with that ambiguity, and then like figuring out like what are their superpowers, how do they fit into this mission, like how do we work together. I think for me, when it comes to like direct hires I've made, I'm always hiring people who are quite different than me and have different skill sets than me, and that's been hugely helpful because it's not like I'm trying to get them to do what I'm doing. It's more like, here's this hole we have to get to, and how do we sort of like mash it together, and have everyone sort of like have their special place where they're able to drive a lot of extra impact. And so some of the folks that help build the design lab with me were just like really remarkable. They were like, we don't care about the politics. We don't care about the ambiguity. Like we want to see this thing work, and they put their heart and souls into it. And so that was a really incredible portion of that experience too.
But it is a very different approach than some, there are times where people are sort of like, well, I need specialization A and specialization B, and like they're sort of building their, and what I felt like I heard you say was more of the like, it's a coalition of the willing, right? All I'm
Yeah,
looking for is momentum and enthusiasm, and then we'll figure out how what you have fits into the wider, we'll figure out how your skill set fits into this. But what I really need is the motivation of the willing, the motivation of enthusiasm. There's a story I tell at Clover because I had a very motley crew of people, and I sort of had an AMA with the team the first day, and one of the questions that somebody asked was why us, right? Because it was just a bizarre to them. They sort of looked at it and it looked very non-cohesive, and I gave them the need for cognition scale, the like that personality instrument that's like basically just like how much do you like solving problems and thinking. And they took it, and then they all looked at each other and were like, well, we get it now, right? Because I'm like, look, we could teach you all the skills. The skills are science is a lovely, we know how to teach science to people. Like it's not, we're not blazing new trails there, Copernicus, right? Like, but if you're willing and you're motivated and you're interested and you're leaned in, we can probably make it work.
totally. I mean, for me, for talent, you can't teach empathy and you can't teach intrinsic motivation. Like those are kind of the two things I need in anyone working with me to like be successful. But I feel like you can basically create any team, solve any problem if you have those two things together. Like those are the superhumans.
Well, you certainly are superhumanly empathetic and intrinsic. You've always been very like forward motivated and thoughtful. We got to come to Cityblock now, right? So you're at CVS, you recognize, hey, I don't have to turn the crank anymore. The thing is like the engine is running. I have the capacity to step away and slip away. And you step into your first true, head of behavioral sciencey kind of like role. Why Cityblock? Like, how did this come up? Did they come to you? Did you come to them? Like, how did this sort of develop for you?
Yeah, it was, I mean, through COVID, I was doing so much, or the team was doing so much social determinants of health and vaccine equity work through the lab at CVS during those rollouts. And I was like, it would be amazing if this was 100% of my job and not half my job or 25% of my job. And I was like, where can I go where this is right? Like I could have CVS had a double bottom line for sure, but it's still like it was like a Fortune 10 very large company. It wasn't actually, if the health outcome became non-profitable, they're not going to ever pursue that health outcome, right? And I was like, what is a place that's explicitly that double bottom line? And Cityblock was so interesting. I was like, oh, they're trying to do this thing. It seems like a grand experiment. Like, can you make high quality Medicaid care scalable? So like its existence was sort of an experiment in and of itself. So I just reached out to Toyin. It was like a cold outreach, and we had some conversations, and like she's a brilliant human and can probably motivate anyone to do anything. And from there, it was just, yeah, like a couple of conversations over time. And at some point, it felt like Cityblock had reached a sufficient scale where some of these tools could be useful. And they were really interested in like, how do we build trust with members who have had extremely bad experiences with the healthcare system? Like, how do we engage people in care who are transient, struggling with alcohol abuse, whose cell phones get shut off because they run out of service. And I was like, okay, talk about like complex, difficult problem space like that. That was what they were doing. And so that was the appeal for me. I was like, let's try to bring the same toolkit, bring the same sort of like way of thinking, but one, to a place where the problems they're trying to solve were so much bigger, and two, to a place where you could kind of get it in on the ground floor, right? At CVS, I was trying to retrofit ways of working and a framework onto a place that already had pretty well established ways of working. And here is like, oh, here, like the teams are new, the people are new, the energy is flexible. Like it could be just part of the equation from the beginning. And so the idea of that was really appealing.
I could totally understand that. If there's anything that ever made me stop doing bside.io, it would be, man, retrofitting something that's already moving and is already big and it's hard. That is,
Yeah.
going to the Fortune 100, Fortune 10 and trying to, you know, shift the arc of that, extremely momentous, lots of mass, has its own velocity thing is very hard. And you've been there for a while now, 3.5 years. Do you still feel activated by it? Are you still in that place of like feeling like, hey, or are you starting to see the signs of like, I've cranked the wheel and it's kind of running without me, and maybe I need to find my next adventure?
No, I love it. I you do not solve Medicaid engagement problems in 3 years. So there's like
Turns out.
so much left to do. No, I love it. It's just like such a crazy place. It is a venture-backed startup, right? So it has the ups and downs and all the twists and turns of that experience, but it's attracted some of the like brightest people I've ever had the opportunity to work with. And so to like have that brain trust in one place, trying to solve this complex problem is really fun. Um, I don't know when anyone's going to raise $1 billion for Medicaid again. So to me, it's like we got to get this thing right and make it work and like get folks the care that they deserve and should have. And so no other mission right now is calling to me more than that. It's been great. And it's been a huge adaptation. Like I think I thought I would bring the toolkit, apply it here. Experiments look different when you don't have 10,000 pharmacies, when you have much smaller sample sizes, really diverse populations, Medicaid rules that are different state by state. Um, I use the word triangulation a lot at Cityblock, where I'm like, here we have this really imperfect quantitative signal and this really imperfect qualitative signal. Like, what else can we fill in to figure out what's actually going on? And it's a really different way of thinking about experiments and sort of continuous learning cycles. So it's been a lot of fun and still a lot to figure out.
Yeah, that cross validation piece is huge, especially when you are someplace where you don't have the benefit of, working at Clover Health, right? Starting a Medicare Advantage plan from scratch, right?
Yeah.
You don't have the giant Humana data set of 80 gajillion. And, some of these things are purchasable now. You can get, actuarial data sets and stuff that allow you to do some stuff, but it is really you know, you gotta try and find that little tiny thread in the noise that you can combine with some other thread into a rope in a really interesting way. Um, and you do such amazing work there. I know you have both sort of started your thing, you've taken in and merged with other teams. It's been kind of a windy journey for you. What do you look forward to, even as you stay at Cityblock? What is the next thing? You've always been somebody who has grown, right? Throughout your career, you're always, there's been a constant theme of sort of learning and evolving. Where do you see your learning and evolving going? Where do you see yourself growing? Where do you see yourself stretching these days? Other than coming on a podcast to talk to me, which I know is not always your happiest. You're not, I don't want to talk to that Matt Waller guy in public. He's insane. But other than stretching to talk to me, where else are you sort of stretching as a leader these days?
Yeah. I mean, I definitely don't have a plan. I think that's probably been a continuous truth throughout my career. I just never really had a plan and sort of figured it out. But I love going deep on the content and like thinking about bigger and bigger problems. So there's a lot to think about here. How do you get someone to control their diabetes when they like don't have access to food or a place to live, right? Like that, there's so many micro problems within that to solve for. So it's been keeping me busy. I think over time, I'd love to expand what I've done in health to other places. I think about like financial well-being. I think about the education space, like how do you get students to thrive in school? How do you get them in school even to begin with? So over time, like would love to expand that to these other problem spaces, and the global strengths still pull at my heart. I think that is whether it's in like education or health or financial security, like working on a global scale again at some point is something I'd love to do.
Well, look, you've had such a wonderful career, and what a wonderful place to leave it as you continue aspirationally to do these things. Thanks so much for spending some time with me, Aarthi. It's always so much fun to talk to you, and I always feel good afterwards. And so thanks so much for coming and spending some time with me today.
Yeah, thanks for having me. This was fun.